Namaskar, good evening, Sat Shri Akal, Salam. Once again you are with me, Get Well with Dr. Kapoor. आज हम उसी continuous series में जो what we are discussing about hypertension, we want to continue. आप सोच रहे होंगे इतनी सारी लंबी series on hypertension, what is the point? We are giving importance, emphasis on hypertension because previously भी मैंने कहा है कि it is the biggest killer of mankind all over the world, globally. Can you imagine about 20-25% of the people worldwide have hypertension, and hypertension as such number wise, so there is no problem, 120, 130, 140, 160 you are told that, but as the number increases, the trauma to the vascular system, जो arteries हैं, धमनियाँ होती हैं आपके हार्ट की, किडनी में, वो ट्रॉमेटाइज होती हैं. One fine day person presents with stroke, with heart attack, kidney failure, and that is the cause of the high mortality. So I don't want to terrorize you or frighten you by just saying the number. It is actually. And over the time, our fight has been with hypertension. Last 7 decades, we keep on changing. I mean, say the American Heart Association, various studies, research papers have come up. Lot of studies. They keep on changing the number pattern also because we are not sure at what level the pressure in the body is best for the body. But जैसे जैसे artificial intelligence का हम models बनाते हैं, data collect करते हैं, so then at least we reach to some conclusion. 120/80 is the best for everybody, nothing like that. You live normally, but even 120/80 may be high by some studies or by some standards or by some data. But we have to maintain the balance, otherwise we are nowhere. We will always keep on blindly. But this is a fact. Since 1977, I have been following. I have seen the studies started for the blood pressure. एपिडेमियोलॉजिकल स्टैटिस्टिक्स के हिसाब से एक जमाने में 150, 90, 160, 90 भी नॉर्मल माना जाता था. वी आर नॉट टचिंग देम एंड सिंपली यू मस्ट हैव स्टार्टेड 80s 90s में आपने सुना होगा एपिडेमिक ऑफ हार्ट अटैक स्ट्रोक स्टार्टेड केप्ट ऑन इंक्रीजिंग. सो देन वेरियस स्टडीज kept on coming, epidemiological statistical data collected, and then every 3, 4, 5 years the definition of hypertension is to, sometime it will go 130, 80, 140, 90. The latest है 120, 80 being normal. Elevated blood pressure 120, 80 to 130 by 80. And as you go higher up, you start calling as hypertension. And 140 by 90 is definitely above that is hypertension that needs immediate and long-term attention. तो अब हमें हाइपरटेंशन को स्टॉप करना है. वी वांट टू स्टॉप द हाइपरटेंशन, ब्रिंग बैक द प्रेशर टू द नॉर्मल, एंड वी रीप द फ्रूट्स ऑफ बेनिफिट्स ऑफ गेटिंग व्हाट इज कॉल्ड एज गुड हेल्थ, लॉन्गेविटी एंड लिव फुल लाइफ विदाउट एनी मॉर्बिडिटी. सो उस पॉइंट ऑफ व्यू से हमें उस डायरेक्शन में जितना ज्यादा हम वर्क करेंगे उतने ज्यादा हम अचीव करेंगे. I don't recommend to encourage people to go on medication, but then this is the last resort. But there are lots of armamentarium available. हमारे पास बहुत सारी चीजें अवेलेबल हैं 1, 2, 3, 4 जिसको हम पहले कोशिश करते हैं नॉर्मल कोल्ड केसेस में जो कि प्रेशर बहुत हाई नहीं है, so as to control them with that or even prevent with them. Even reversal of hypertension is possible. बहुत सारे पेशेंट हैं हमारे दवाइयों पे चले जाते हैं, but then they start following very disciplined lifestyle, full-fledged physical activity, and the best diet pattern which the guidelines say for the blood pressure for hypertension, and they get rid of their medications. They are free of their medicines, they live lively and they live happily. So that's why we always tell that you have to follow all the disciplined life so as to get the best outcomes. So what is the best physical activity? I mean, say you keep on doing the whole day the physical activity, you will be happy. But then what is the amount of physical activity you do? You have to maintain a log of that in your mental state. I'm saying it's not like they give them 150 minutes per week, or like every day should be physically active. And we can start with simple breathing exercise, which is also a physical exercise. You can do pranayam, you can do Kapalbharti, and then you can do cardio exercises on a treadmill or in a walk in the mall or in the garden or wherever you get chance. Don't count the minutes. Your body yourself will tell you that, okay, you are doing the best of exercise, I'm happy with this exercise. And the results will be there. The lifestyle is again very important, which is very difficult to manage in the world which we live now, running around, putting the car on and driving on the roads for miles together, sitting in the office with a lot of meetings and all. But then that's a part of the life. You have to have that. So you have to see how to balance that, and you are the best just for that. Diet is very important. डाइट पे आपको उतना ही ध्यान देना है जितना कि आप अपने वर्क को इम्पोर्टेंस देते हैं. ना खाना, खाली पेट रखना, एसिडिटी प्रोड्यूस करना, लेट नाइट खाना, बिंज ईटिंग करना, रेस्टोरेंट्स में खाना मोस्ट ऑफ द टाइम. और जब खाना तो वो ऐसा खाना खाना जिससे कि और बॉडी पे लोड बढ़े, ब्लड प्रेशर बढ़े. तो यू हैव टू बी वेरी पर्टिकुलर. देयर आर लॉट ऑफ डाइट पैटर्न्स अवेलेबल, लॉट ऑफ डाइटरी थिंग्स आर अवेलेबल. यू हैव टू डेवलप द सिस्टम इन योर किचन, in your home, in such a way that every meal has to be the best of the meal for your body system, for the blood pressure. Salt को reduce रखना है. Salt की इतनी जरूरत नहीं होती जितना हम लोग खाते हैं. 1/3 of the salt if you take is very good for you. So you can imagine if you are a salt eater in your home family, if one of you or anybody develop blood pressure, you should go to 50% reduction over the time. 1/3 of the salt intake should be there. So salt पे emphasis हम इसलिए देते हैं, इसीलिए कहते हैं मिर्चा, मसाला, तली चीज, ऑयली, हैवी foods avoid करने. And then we have to be more on the high fiber fruit, vegetables, salads, millets, intake nuts. Very tasty foods are available. So you did not go indulge into a lot of gravy based and salted, spicy, heavy foods. Fruits, vegetables, salads should be a part of your feeding pattern. And then of course lifestyle, again I want to put small sentence before I complete this video, that indulgence in some of the toxic things which we have developed in the modern lifestyle, like tobacco, smoking, drinking, especially alcohol. Even Americans now, Heart Association, they say the drink even if little is not good for the body system as far as the blood pressure is concerned, because once upon a time they used to even allow 2 to 3 drinks per day are involved. So that becomes 12, 15, 20. So that itself can give rise to a hypertension stage, and it can be reversed just by stopping the alcohol. So my advice is just to avoid alcohol if possible, no alcohol at all, or once in a while in blue moon it's okay if you are really fond of that, or just become unfond of that. Same is for tobacco, same is for smoking. So ये 2-3 चीजें मैंने बड़ी बड़ी इसलिए बताई कि सिंपल फॉर्म में आप खुद समझते हैं आपको क्या खाना है, बट ओनली योर मेंटल स्टेट, योर बिहेवियर पैटर्न, योर कोग्निटिव सिस्टम हैज टू get attracted to those good lifestyle, diet pattern, and physical exercise program. And I assure you that your blood pressure one day, if you have hypertension, will come back towards normalcy, or at least it will get better. If you are on medication, the medication's amount will be decreased, or at least it will not increase over the time. And if you don't have the blood pressure, it will prevent development of blood pressure. So prevention is also possible in the people who have a strong family history. Genetic factors are working to prevent blood pressure. You have to follow what I just discussed. So we'll keep on discussing blood pressure till we are confirmed, we are assured that we could reach to the community to give them a guideline, change their behavioral pattern, bring them to a good lifestyle, and that itself in the long term will be benefiting the whole society by decreasing the mortality and morbidity of hypertension. We'll soon come up with more and more information on blood pressure. We will make sure that you benefit a lot, And if you like this video, please do subscribe our channel, save it and share it with others. And if any questions, you are most welcome to ask me directly on going my site www.getwellwithdrkapoor.com, and we are always there to help you in getting the best of the health. Thank you so much and namaskar.